Injection, pigmentation. All right.
I have like this area like dark circle, especially this part.
Okay.
So I just want this to be sharp,
To be what?
like this.
Can you remove your mask for me fully? Okay, thank you. And I also want to see your ears, both the sides. Correct. Now I can see the full face. All right. Now, what is it you want to do about your lip circles?
Like lip reduction.
No, you're not a good candidate for that. So, see, the problem is not lips with your face. The problem is here. So, your jaws are too broad and too short. So, we will have to get this broad part of the jaws inside and this part that's inside, outside, and downwards. That will change your lips, cheeks, everything. But we can't touch the lips alone. So it's not going to be a work on the soft tissue or muscle. Instead, it's going to be work on the bone. That's where your problem lies.
So my face is gonna change totally.
Not totally, but it will change. It's not going to change totally. It's just going to be a improved version of your face. If you want to come to the mirror, I can just try and explain what I'm trying to say. Okay, now look there. Now the first thing is, when you look on the side view, this is inside. It's really in. Then this height is less and this is broad. So if you look here, so we have, and because of this reasons, this area is affected. Looks like, it desires something. It's not clear. So when we get this part of the jaw bone forwards and downwards with the help of genioplasty and sculpt the bone there with jaw sculpting, so you're going to get that sorted out. That's one procedure that you need. The second thing is, if you look at your face, look in the mirror again, this is what we call as a intermalar distance, okay? And this is, look there in the mirror, and this is the distance between your lower jaw. This distance has to be more than this distance. But for you, it's not the case. You have like a big bone here and also muscle that's sitting on that bone, which is giving your face a squarish look, not an angular look. So now look in the mirror. This needs to go in like this. See what happens. That gives a much more nicer look to your face, a balance to the face.
And I will come here.
Yes. And the lip will get settled on its own. So we don't touch the lips directly. Because the lip muscles are all around the lower jaw, and then when you move those jaw bones and put them in a much more better position. Now how many millimeters I'm going to move, what millimeters we're going to take off, is it going to be lower border, is it just going to be a shape, am I going to work on your muscle, all of that I'll plan on the scans and I'll tell you details before we do the surgery.
Okay.
But we shouldn't do anything on your lips as to not needed. But your result that you're looking for, which is going to get corrected with what I'm saying.
This part, I know, because this part I am not like satisfied with this.
That part is going to improve like big time.
So, and like with this, like I feel like I have even teeth problem maybe.
All that you feel now, but once the jaw's in the right position, it's going to just be taken care of on its own.
And how
We're not
about
going to do anything on the teeth.
How about recovery time?
Recovery time, Baba, is going to be like a week to 8-9 days. Now, if you're giving me a Canada address, then you have to hang around here for maybe 10 days in our city.
Because I asked them, just please give me like later that I could like give them for extra my like time off, but nobody answered here.
So where are you going to go back now from here?
I have to go there like within 2 weeks.
2 weeks is good. I said 10 days.
But I have to go back to like Odisha even.
Orissa.
I need a little more
Hello?
time.
Hello? See, you have to, let's say we do your surgery tomorrow, let's say. So you need to be around in our city for at least 9 days or 8 days, better, safer for you. Then you go off to another place and after 2 weeks you can go back to Canada, not a problem.
And like after dates not gonna problem, कोई problem नहीं होगा ना?
नहीं, प्रॉब्लम तो नहीं होगा, लेकिन हीलिंग के लिए टाइम लगेगा. हड्डी में जब काम होता है तो आपको लग जाता है 4-5 महीने. हाँ, लग जाता है टाइम इतना.
फूड खाने का
लिक्विड डाइट होगा फर्स्ट 3-4 दिन, उसके बाद सेमी सॉलिड होगा. ये सब नॉर्मल है ये सर्जरीज के लिए। और आपके जॉ में थोड़े प्लेट्स और स्क्रूज भी आ जाएंगे, कोई टेंशन नहीं, लेकिन आएंगे, वो रहेगा वहीं पे।
ये थोड़ा साफ हो जाएंगे और पतले हो जाएंगे
बहुत। और आपका जो फेस अभी जो स्क्वेरिश है और जो यहाँ पे शॉर्टिश है, इसके वजह से आपके लिप्स में प्रॉब्लम्स दिख रहे हैं, लेकिन एक्चुअली प्रॉब्लम्स लिप्स में नहीं है। तो जो प्रॉब्लम आपके हैं वो वहाँ पे प्रॉब्लम नहीं है, बट जो मैं सजेस्ट कर रहा हूँ उससे वो प्रॉब्लम सही हो जाएगा आपका।
एग्जैक्टली लाइक पोर्टफोलियो मेरे को दिखा सकते हो कि ऐसे ऐसे आपका फेस दिखेगा, लाइक एग्जैक्टली?
तो एग्जैक्टली तो नहीं कर पाएंगे, क्योंकि सॉफ्टवेयर में तो कट कॉपी पेस्ट होता है, आपको मालूम है।
हाँ।
सर्जरी अलग होती है। आपको आइडिया दे सकते हैं, जैसे कि मैंने आपको आइडिया ऑलरेडी दे दिया है। अभी और आइडिया देने के लिए मेरे को आपके स्कैन्स पे टाइम स्पेंड करना है, मेजरमेंट करना है, प्लान करना है, तब जाके मैं आपको बता पाऊंगा कि लुक यहाँ पे ये होगा, यहाँ पे ये होगा, ये वो। आपको मैंने ओवरऑल आइडिया समझाया है। देखो, जो हम आपको सजेस्ट कर रहे हैं ऐसा कुछ भी नहीं होता जैसे कि ये परफेक्ट फेस, ऐसा कुछ भी नहीं है कि ये परफेक्ट नोज, ऐसा नहीं है। एवरीथिंग इज अ प्रोपोर्शन, मतलब ऊपर जाकर नीचे जाकर बैलेंस, नाक का फेस के साथ का बैलेंस। तो ये बैलेंस हम इम्प्रूव कर रहे हैं हम। तो क्या होगा, आपका एंड रिजल्ट ओवरऑल फेशियल एस्थेटिक्स तो पक्का इंप्रूवमेंट ही होगी। तो इट्स नथिंग लाइक अ परफेक्ट फेस। ऐसा नहीं कि हम लोग यहाँ पहुँचना ही है, ऐसा नहीं है। ये जो रिलेशन अभी क्या बोल रहे हैं इतना ठीक नहीं है, उसको हम ऑगमेंट करेंगे तो डेफिनेटली बेटर ही होगी, इसमें डाउट नहीं होगा।
एंड इसका टोटल कॉस्ट क्या है?
वो तो आपको बता देंगे, अभी फिलहाल आपको तो करेक्ट बताया नहीं था कुछ भी, मतलब आप बोल रहे थे कंसल्टेशन।
एग्जैक्ट नहीं पता था कि लाइक
करेक्ट। ये क्या होता है ना, हमें भी व्हाट्सएप में नहीं मालूम पड़ता डिटेल्स। पेशेंट्स कभी कभार को लगता है प्रॉब्लम कुछ है और है, एक्चुअली प्रॉब्लम्स कुछ और होगा। Like with her, it happens sometimes. And some of the patients, you won't believe, we tell no surgery for you. Because they think there's a problem, but unfortunately there's no problem. So all kinds of possibilities do come out. So then, that's why the really, in our medical field, if I tell you, the first step is called inspection. Patient को देखना.
Yeah, that's correct.
दूसरा होता है palpation, patient को छूना. Then auscultation. मतलब कोई टॉर्च से देखा या किसी से, फिर हुआ इन्वेस्टिगेशन। तो ये प्रोसेस के बिना तो हम अच्छा करेक्ट खासा एडवाइस नहीं दे सकते किसी को। आज फिलहाल वी हैव लॉट ऑफ एडवांसमेंट, तो व्हाट्सएप पे कर रहे हैं, ये सब आइडिया है। ये परफेक्ट नहीं हो सकता ना, कैसे हो सकता है? अभी भी मैं आपको आइडिया दे रहा हूँ, पूरा परफेक्ट नहीं दे रहा हूँ, क्योंकि हम थर्ड स्टेप तक पहुँच गए, फोर्थ नहीं पहुँचे। स्कैन देखिए मैं बताऊँगा और भी क्लियर डिटेल। तो ये you can go for a scan now, then we can have a look at your scans, and then once the scans come we can tell you, but we need time to go through your scans like in detail also, but I can tell you.
Like I do feel like my 4 teeth here and 4 teeth here are more this and this.
But we don't have to do anything on your teeth. After everything you will feel comfortable.
And my smile will change?
A little bit, yes. It will change a little bit, right? Because that's why your lips are looking like that now. It's going to change for the better.
Not like lips. I have hair like dark.
Yeah.
So I just want to remove this one as well.
That discoloration around the corner of the lips? No, we can't do that.
No?
No, that's not possible. That you can apply some cream or something later on. It's not a procedure for that. You don't need a procedure for that. इनका स्कैन हो गया? नहीं ना, स्कैन करा लो पहले।